Welcome everyone to our QI project, increasing utilization of GAD-7 assessment in the EMR by primary care physicians to improve the diagnosis and management of anxiety disorder. I'm Dr. Barrera.
And I'm Patel. We're all third-year residents at WellSpan Samaritan Hospital.
And I'm Dr. Afridi. We want to thank you for taking the time to come check out our solution to a problem with our EMR that we felt needed to be addressed.
What we have noticed during our residency training is that providers were using PHQ-9 for depression and not the GAD-7 for anxiety. So when we asked the other providers why they were not using the GAD-7, and most of them said that the PHQ-9 is in the screening tab and it is very convenient for them to use it. However, they don't even have a GAD-7 in the EMR, so it was time consuming for them to even use it. Rather than just asking my patients how they feel, I prefer to use a scoring tool such as a GAD-7 to help me assess my patient's treatment response over time. But without help from the EMR, I have to pull my phone out during the interview and open it up in MDCal and then manually import the score into my note and finally to compare it to their previous note. I have to flip through my old notes and it is extremely inconvenient and time consuming.
That's right, Feroza. The reason we chose this project as our hill to die on was we noticed it was super easy to screen for depression in our EMR using a well-integrated PHQ-2/PHQ-9 built into the screening interface, but the GAD-7 score for scoring anxiety is actually hidden in a deep, dark corner of the flowsheets tab, almost as if it was planned to be used in the final editing stages of the EMR production, but it was deemed not essential enough for prime time and thrown into the director's cut at the last second. Atif, what do we know about anxiety?
Sure thing, Trajan. So according to the Anxiety and Depression Association of America, generalized anxiety disorder affects 6.8 million adults, or 3.1% of the US population, yet only 43% are receiving treatment. Women are twice as likely to be affected as men. People with anxiety disorder are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for psychiatric disorders than those who do not suffer from anxiety disorders. The GAD-7 was originally designed as part of a study between 2004 and 2005 with over 3,000 participants self-reporting their symptoms and severity. Patient self-reported scores were compared with practitioner assessment and found to have sensitivity of 89% and specificity of 82%.
So our project idea is to launch an information campaign with posters, handouts, and information sections to teach residents, attendings, nurse practitioner, and physician assistant on how to bring the GAD-7 scoring tool from the hidden depths of the EMR to a more user-friendly location that's easier to use in order to increase usage. We'll also show everyone a helpful dot phrase that can pull in the results of the recent score and quickly interpret it.
The study is a pre-test, post-test quasi-experimental design, and the information campaign will last 1 month to allow adequate time for incorporation at both our urban and rural clinical settings. We will pull keywords such as GAD, GAD-7, and generalized anxiety from all practitioner notes for 3 months prior to and 3 months after the information campaign, and then compare the usage in the notes using two-sample, t-test, and ANOVA for statistical analysis.
As of now, all our posters and handouts are finalized and we'll be starting our information campaign this month. We predict that making the GAD-7 scoring tool easier to access within the EMR will increase its usage in all our clinics. The impact we expect to have is 1. Increased use of an evidence-based scoring tool over time will allow clinicians to treat patients with anxiety better. 2. To reduce GAD-7 scores in a statistically significant manner. And 3. To influence the EMR design team to put the GAD-7 scoring tool into the direct screening interface along par with the PHQ-2 and 9, which they initially declined at our original request.
So we also believe that using the GAD-7 in the clinic will not only benefit the providers, but the patients as well. From the provider aspect, it allows us to systematically measure the progression of their anxiety, whereas from the patient perspective, it gives them an opportunity to self-reflect and express their frustrations with their own anxiety, since sometimes it can be very challenging for someone suffering from anxiety to express themselves in words.
Thank you again for joining us, and we hope that whatever happens, we believe that by using the scientific method, we can do what is best for our patients. That is why it is imperative for GAD-7 to be easily incorporated into the EMR front and center.
We'd like to take this time to thank the faculty that helped us with this project, Dr. Azhar, Dr. Khan, and our program director, Dr. Abdul Waheed.